on their own would be to use somebody early on as a consultant for that billing and coding. We did end up in our end of our first year consulting with an outside billing and coding and really getting some expertise, but I would do that from the front end. Another challenge we faced was in our state we were unable to bill Medicaid. We had to get a separate accreditation, and that was AAAHC, which is the Ambulatory Healthcare Accreditation. And we chose to be accredited as a medical home. And that was a pretty rigorous survey process, and it will be rigorous going forward in terms of the standards that we will have to meet to comply with the medical home. But it was an excellent learning experience going through that, and meeting those standards really helped us become more of a medical home. Again, one of the benefits as well as the challenge was the EMR. The providers that we ended up having in our primary care just by chance did not have EMR experience. So there was a struggle early on to develop that flow with being able to look the client in the eye but yet still use the computer because they didn't have that experience. And so they really probably took longer early on with visits and really getting moving with the flow. I will say both have now really gotten good at this, but it was quite a struggle early on. Another thing that we struggled with is we did not have a registry for tracking patient diseases and outcomes when we started. And now we will be working in collaboration with the National Council at implementing a registry. That's coming to us here within the next month or two. And we're really looking forward to be able to show, because we know anecdotally that we have a lot of success with our clients, but we can't prove it. We don't have the outcomes to prove it.
Kim, this is Kathy. I'm going to need to move us along just so we give everyone a chance to speak here.
Sure.
So sorry we didn't get to your financing slide, but if you can wrap up here in just a few seconds, that would be great.
That's fine. The financing slide sort of speaks for itself, and anyone who has questions can ask those at a later point.
All right. Thank you very much.
Thank you.
Our next speaker is Beth Wobel from HealthLink. Beth is the CEO. With an interesting background as an engineer. So, Beth, would you talk a little bit about your integration with Porter Stark and bringing healthcare services to folks in a community behavioral health setting?
Yeah, thank you, Kathy, and thanks for giving me the opportunity to talk about what I think is probably one of the more exciting things that we've done here at HealthLink with our great community mental health center, Porter Stark Services. We're located in Valparaiso, Indiana, northwest Indiana, about an hour from Chicago. And we've been partnering with Porter Stark for over 10 years in some way or the other. We just didn't know we were doing this. The last 6 years, thanks to a grant, some seed money from the United Way of Porter County, we were able to bring some of Porter Stark staff